I'm Bernadette Wagner, and on behalf of Hospice of Washington County, I'm pleased to welcome you to Healing, Hope, and Health. Everything you ever wanted to know about hospice, its services, its staff, volunteer opportunities, its community outreach efforts, information about our first hospice house in our community, or ways to support the organization is all right here on this program. Today, it's my pleasure to introduce Shelly Steiner, Hospice of Washington County's Director of Strategic Initiatives. In her role, Shelly oversees the HWC's legislative initiatives. She oversees the marketing department and manages our RN care consultants, who are specially trained nurses that coordinate closely with the staff at Meritus Health Systems to ensure the best end-of-life care for patients. She joins us today to talk about hospice care delivered in the hospital and the collaboration that occurs to meet the physical, emotional, social, and spiritual needs of every patient and their family members. Welcome, Shelly. Thanks for being here.
Thank you, Bernadette.
So let's just start off by saying, first asking you, how long have you worked for hospice?
I came to hospice at the end of 2008, so it's been almost 9 years.
That's great.
Yeah.
That's a long time. Thank you for your service. So, Shelly, a lot of folks think of hospice as only providing care to folks who are living in their home. But, you know, on this segment today, you're going to be talking about hospice role in partnering with our community hospitals. What percentage of our patients come to us or referred to us through the hospital, and what percentage do we actually care for in the hospital?
Right now, about 39%, I think last month was 39% of our referrals came from Meritus Medical Center. And then also from some of the other hospitals, maybe down the road, but mostly from Meritus.
Okay, and sometimes we will pick a patient up and then they're sufficiently well to go home. Does hospice provide the care and coordinate that move home?
We do. We provide the care. We work very closely with the care management team at the hospital to identify patients who are perhaps end-of-life patients. We evaluate them, and we also are able to help with them with, if they're eligible for hospice care, to help them with the discharge planning and to get them to a safe environment. Sometimes those patients leave and go to their homes. Sometimes they go to nursing homes. About 50% of our patients are in facilities, and about 50% are home patients.
So for our, in our collaboration with the Meritus nurses, how does that work between the hospice nurses, the care consultants, and the hospice nurses?
So our care consultant, right now we have one nurse who's at the hospital. Her name is Jamie Weatherly. And Jamie does a wonderful job of working not only with the care management team, but also with the palliative care unit that is led by Susan Lyons. So she is always in contact with them and working to first identify patients and then also to see if they want hospice care, helps with the evaluation. She also helps if the patient has symptom management that they need while they're at the hospital. If that's the case, then Jamie also becomes kind of the consultant back to Meritus as to how to manage pain and symptoms while that patient is enrolled in hospice in the hospital and then continues on with us.
So it's a really nice give and take and a support for one another. I'm wondering, is it a support to, so if a patient is at Meritus and they're not enrolled in hospice, they have to do all the discharge planning and manage that. So is it a support to them to have the hospice patients discharged, carried out by our staff?
It is, and when they're enrolled and become our patient, then we are responsible for doing the discharge planning. And it's a help to them, but they still help us in managing that. They have a lot of systems in the hospital that they can manage and get things done smoothly. We have our own systems, and we kind of meld those together in order to have the best possible outcome for the patient and the family.
That's great, and that's what the focus is all the time for both agencies.
For both agencies. And we're always thinking about how would this be best for the family. They are tremendous partners with us, and it's a very smooth transaction most of the time.
That's great. That's great. And Shelly, how do you does Meritus or how does Hospice of Washington County foresee this collaboration moving forward when we open Dowie's House?
When we open Dowie's House, we're thinking that the transfer of patients that are eligible for hospice care and eligible for going to Dowie's House for pain and symptom management, we believe that that will make it very simple. They're very much on board and anxious for that process to start, as are we. And we will work together to make sure that that transition of just moving the patient from the hospital room to right across the street. And you can see Doey's house. Standing in the palliative care unit at Meredith, you can look out the window and see Doey's house. And so the excitement has been building for both of us to provide that extra level of care.
That's great. That's great. And I don't know if you know this or not, but I know that Hospice has 185 or so volunteers and looking to recruit more, especially when we open Doey's house. But do volunteers also see patients in the hospital, or are they strictly for people in facilities and at home?
There are times when our volunteers come in, not as often as they would in the home or in the facility, but they do come in, especially when someone is maybe close to death and we need people to sit with the family. Our volunteers have gone in and done 11th hour vigil, it's what we call it, and they help just to be there with the family or to be there with the patient who doesn't have family.
Or to be a listening presence.
Yes.
Yeah, that's great. Well, Shelly, we're almost out of time, but I was wondering, do you have one particular story that you would want to share that kind of highlights that collaboration between Meredith and Hospice of Washington County?
I don't think I have one story that just came to mind, but I see it every day. When I'm over there, and I'm sometimes over there with Jamie and sometimes go on rounds in the care management, and I just enjoy watching the collaboration. I watch how they are looking out for patients. They're very careful to help present hospice to the patients that might need us. Sometimes we do those in joint meetings, and I think the collaboration between those two groups, the care management team and the palliative care unit and Hospice of Washington County, is a great thing for this community.
Well, I'm sure it benefits the patients and their families.
Absolutely.
Thank you so much for being here today.
Thank you.
I'm sure, like me, you appreciate the compassion and dedication of HWC's and Meredith staff nurses. I also hope, like me, you have a new understanding of how Hospice of Washington County and Meredith work together to meet the medical, social, emotional, and spiritual needs of each patient and their family members. We've learned a lot, but if you want, or if you have additional questions about hospice care, please call Hospice of Washington County at 301-791-6360. Stay with us. We'll be right back after this commercial to talk with our youngest guest ever.